South Africa is caught in the second COVID-19 wave and the healthcare system is taking some strain. Over 24,000 people have died since the first case was announced. Our reporters are out and about monitoring the situation countrywide for us this morning. Mankoba Mkunu is in Johannesburg, Spamandla Goge is in Polokwane, Mawande Keswa in Durban and Nobisutu Hejana is in the Western Cape, the province leading the pack in terms of the number of daily infections. Let's head straight to Limpopo now. That's where we find Spamandla Goge. So, Spamandla, a very good morning to you. And yes, the concern being about people who are travelling. To just remind us how Limpopo has been faring so far in terms of numbers and how they're coping, because they haven't really made headlines when it comes to COVID-19. But of course, the danger now with people coming from other hotspots to Limpopo.
Indeed, they may not be declared a COVID-19 hotspot for now, but provincial authorities are worried because many people are flocking into Limpopo from Gauteng. There are many people from this province who work in Gauteng, which is one of the hotspots, by the way. Limpopo is on high alert for now, but it's also, our viewers would recall that this is one of the tourist attractions in terms of people visiting Limpopo and also people making en route to other neighboring countries. So this province has got a confirmed number of about 20,220 cases with more than 500 deaths. That's relatively low compared to other provinces where my colleagues are focusing on today. But right now, we are joined by the Health MEC in Limpopo, Dr. Popi Ramathuba. Thank you very much for your time. The second wave, are you ready for it? How are you coping for now?
I think in terms of infrastructure, we can reassure the people of South Africa and Limpopo that indeed we are ready. If you want to look at issues of your equipment, this particular hospital has got more than 1 wards dedicated strictly for COVID-19. We've got an ICU dedicated for COVID-19. Our MDR facility, remember, which we opened with 89 beds, that are mainly for ICU and also high-flow oxygen machine, including ventilators. We are ready. But we must indicate and tell people that psychologically, in terms of the workforce, our healthcare workers are exhausted. There is a lot of fatigue. What is making sure that this problem or exacerbating the challenge currently is that we are facing the festive season. When you look at this past weekend, how many people did you report died on the road accidents in this province? When you report an accident that 5 people died, it means you've got 20 that needed hospital admission. So the challenge that we're having is the fatigue. It's the burden of disease due to trauma, road accidents, because we've got to be dealing with them at the same time. Whereas compared to the first, when we encountered the first wave, we were under hard lockdown, wherein the focus was on COVID-19, and mentally we were still prepared and stable.
Are you flooded though for now? Will you be diverting patients to field hospitals?
We are not yet flooded, if I can indicate. In terms of our admissions are still very low. If you look at our MDR facility, it does not even have any cases. Currently, the patients are still being managed at their own peripheral hospital. Because what we did, we don't have any field hospital as a province. What we did was to make sure that we empower each and every hospital. All our 43 hospitals have got a COVID-19 ward dedicated to deal with COVID. So we are still managing to admit patients in our different hospitals.
You mentioned the issue of healthcare workers. The NOSA says, yes, healthcare workers are overstretched, but also they say your department has not filled in vacancies, and that is critical during this period.
I think what we need to appreciate is that we would love to fill all the vacancies that we do have, but does the resources permit? We need to be practical and to be honest here. Where we are having funds, we have been able to appoint. But where we don't have funds, we have not been able to appoint. But in terms of the COVID-19, we did appoint them, but they are on contracts. And remember, their contracts are coming to an end. And it will depend on whether Treasury gives us more funds so that we can extend the contracts. But otherwise, in terms of human resources, we will need more, because the current team that we are having, I must emphasize, since level 5 had lockdown, they're like me and you. We've been working since that time. They've never been on holiday. They've never rested. And now the problem is compounded by the fact that they are having a lot of trauma that they need to deal with.
And on top of that, by the way, now let's talk about the issue of super spreaders events. You are worried about social gatherings in this province, and that has got a potential to raise the number of cases that you are having.
If you look at last weekend, we raise and we caution and we appeal to parents to say, please discourage your children not to go to social gatherings. Then calculate, if you look at the test results that we get on Friday, Saturday, we have been registering 254 cases within 24 hours. It has never happened since July, August, when we were dealing with the wave. We have seen today, we have registered in the past 24 hours, 193 cases. These are young people. When you look at how this virus behaves, it simply tells you they were infected over the weekend, which we have raised, that they've been having a lot of social gatherings. We're still talking to parents to say, don't do it for us, do it for yourself. Tell your child not to go to the party. We have heard what our epidemiologists are saying. The current variants, this virus has got, unfortunately, impact on the young people. It is infecting young people, and young people, when they get infected, that's why it's spreading fast, because they can easily spread it than when it's elderly people who can stay at home.
In closing, your residents are coming back from Gauteng and tourists are making their way to Limpopo. Surely that will concern you too.
It does concern. That's why you saw us on Friday. I was with the MEC for community safety, while she's checking the vehicles and the drivers, we were also screening for COVID-19 and also talking to those who are visiting our province or those who are coming home to say protect yourselves and protect your loved ones. But what is more important, our approach as a province, is that we are currently busy with our door-to-door in villages, empowering our elderly people, those who have been at home, who have never gone anywhere, to say, when your son or your daughter-in-law comes back from wherever, make sure they don't come closer to you when they are not wearing a mask. Make sure before they serve you food, they must wash their hands with water and soap and sanitize. So if we do that, elderly people will protect themselves and then they will not be infected. So we'll continue with that village door-to-door campaign that we've been busy with.
Okay, Doc, thank you very much for your time. That is the Health MEC in Limpopo, Dr. Poppy Ramathuba.
Well, thanks very much, Mandla Goge there, and managing the situation there in Limpopo, it seems. But yes, they too facing their challenges. Well, let's find out what's happening in Gauteng, in and around Johannesburg in particular. Mankoba Mkunu keeping an eye there for us. Mankoba, yes, we were hearing about the struggles in other provinces, in particular provinces like the Western Cape and KZN. And, you know, they will, if people are choosing to travel out of Gauteng this festive season, they'll most likely be heading to places like that as well. But how are we faring here? How are we coping in comparison to other provinces?
Well, Yuveka, of course, there are quite a number of concerns from healthcare workers here in Gauteng about the fact that the province, they say, is simply not ready to deal with the second wave of infection. Of course, you would know, Yuveka, that during the festive season, many of those holiday makers go to the various provinces, and the concern really here in Gauteng is that when those holiday makers come back to the province, Yuveka, that's where there are fears that there could be a spike in the number of infections and the second wave that has been hitting the country. So we did speak to the General Secretary of the Young Nurses Indaba Trade Union, who says, of course, that nurses are simply overworked, they're stretched to capacity. But the biggest concerns, Uveka, are the issues around the personal protective equipment, the PPE, which they say is simply not enough for nurses here in Gauteng. There are still issues that are being raised by some of the members of that particular union when it comes to the procurement and the supply of PPE to various hospitals, saying that some hospitals are forced to use just simple aprons as well as a simple face mask to try and shield themselves from the virus. So they're saying that they don't believe that they're actually protected enough in terms of trying to deal with this particular issue. But more than that, the all-standing issues of staff shortages, the issues of the lack of resources, they're saying that these are big issues here in Gauteng, given the fact that you find in some wards that 3 nurses have to attend to about 45 patients. And they're saying that should a second wave hit, this will really be problematic problematic in terms of the bed capacity as well as the availability and the care that will be given to some of these patients. So the fears here in Gauteng around the first few months of January, where we are likely to see that spike take place here in Gauteng. And of course, nurses and the healthcare workers that we spoke to quite adamant, Juveka, that the province is simply not ready to deal with this particular pandemic. Take a listen to what Richie Sikisha had to say on this particular issue.
So far, at the moment, here in Gauteng, numbers are increasing, but not as alarming as they are doing in the Eastern Cape and Western Cape. Yes, we do have those cases, but they haven't yet kicked us to like compared to the first wave. But again, things it's like everything is normal. We have never been ready. We are not going to be ready if this COVID-19, more especially the second wave, more especially because it's more dangerous. It's more brutal compared to the first wave. We are not ready. We have never been ready. We are still complaining about same old issues, gross shortage of staff. And the gross shortage of staff, what does it lead to? It leads to exhaustion. It leads to fatigue. Those who are in the system have stressed themselves to the limit. We are tired. And the gross shortage of material resources as well. It's just a disgrace, and it's frustrating to say at this moment we are a reactionary country. We are not proactive. We are still complaining about the lack of PPE at this moment in time, because we are supposed to be ready and waiting for this second wave. If it hits us, it hits us while we are already armed, but we are not, unfortunately.
And he certainly does make some very valid points there, Mankoba, in terms of where we are at the stage after months of dealing with this pandemic as well. Just very quickly, I suppose, even if we do manage to sort of have a sort of quieter period in Gauteng, as we usually do over December, I'm not sure if people are going to be leaving the province this time around, but the danger comes in with people traveling to other provinces and coming back to Gauteng after that, especially to hotspots like KZN and the Western Cape or the Eastern Cape as well. So I wonder then what are their predictions for when people do finally return, and their predictions for how we might be or might not be able to cope even further then?
Well, Uveka certainly is a concern, not only to healthcare workers, but we know that, of course, officials are also quite concerned about the migration patterns, given the fact that they do expect a number of people to come back to the province, especially around January when the festive season ends. So that's been a source of major concern. In fact, the advisory committee that advises the Gauteng government saying that they will be looking properly and studying the numbers, of course, saying that, the numbers would indicate just what kind of intervention will be needed here in Gauteng. But there has been an issue, Uveka, around the inaccuracy of those numbers here in Gauteng, especially during November or last month, where we saw some of those numbers not quite really, being the numbers that were expected to be released. There were some issues with the fact that some of them were wrong and they were captured wrong. So there was a bit of issues with numbers, and of course concerns raised as to whether the province could prepare itself adequately, given the fact that it still has not been able to give the accurate numbers for those new infections. But the province, of course, saying that they are now on top of it. They are dealing with the issue of numbers, and of course saying that they are quite confident as a province that they will be able to deal with an upsurge in cases of COVID-19 should this be the case when those people do come back in January next year.
It's going to be such a tense and anxious time. Thanks very much, Mankoba Mkunu there, just keeping us abreast of what's happening in terms of Gauteng and how it's coping. Let's head on over now to the Western Cape. Certainly, Besotho Hejana, you guys having your fair share of challenges, and I'm sure lots of anxiety at the moment as this festive season gets well underway.
Certainly, Uveka, we talk about hospital diverting patients due to these increasing numbers, and the Western Cape Health Department did say that they are concerned with the increasing numbers come January 2021, but at the moment they're not planning to reopen the Hospital of Hope. But to get a sense of how bad things are at hospital and those who are strained, which are the nurses, we are joined by Eleanor Roberts, who is the provincial chair for Denosa in the province. Eleanor, we talk talk about hospitals being full in the province due to the second wave and the spike of infections daily. How are things for nurses? How is the pressure?
Thank you, Nobusuku, for having us and inviting us. Yes, at the moment, the pressure in Western Cape is tremendously. The pressure in the hospitals is tremendously. Hospitals are full, private and the public hospitals. Our nurses who is under tremendous trauma since the 1st of March, the first wave, is now back on a second wave, traumatized over again. And this brings together the fact that the hospitals are full. It's just a strain on our nurses.
And how do they deal with it? Because we talk about the increasing of cases each and every day, and now we have this issue of patients being diverted to other hospitals. How are you coping as nurses?
Nobusuku, let us say then that we cannot cope. That is now a straight fact. As I said, our nurses are traumatized tremendously. We cannot cope. As at Western Cape now, what the numbers that we are having in this week, there was about 6 people who died of COVID. So our nurses are dying, our patients are dying, our community are dying out there, and really we cannot cope at this moment. And then there is this negative pressure on the resurgence that has been put on us as nurses just to work, and every time people are just saying thank you, thank you, thank you, and that doesn't sit well with the NOSA.
And what sort of assistance do nurses need at this particular time, as well as other healthcare practitioners, especially when dealing with people who die on a daily basis due to the COVID and also maybe other illnesses?
What we can say is that our Metropolitan Health Group as Western Cape from the Department of Health do provide employee assistance to our nurses out there. However, it is a fact that nurses are angry, and it is a fact that sometimes not all of us have access to that. So what we do is that we are actually taking each other's hands. We on WhatsApp groups, on social media, we're having these prayer groups that we are having for one another, for our families out there, the nurses in the hospitals. We're having prayer groups, and so much we are supporting another. So there is that support from the Department of Health, but not as we would have liked it to.
And what would you like to say to the public, because we do see people who are not adhering to the protocols, and you guys are putting your lives at risk by attending to those matters. So what message do you have for the public when it comes to the seriousness of COVID-19?
Thank you. This is so an important question. What we want to note as the NOSA, right in the beginning, the nurses were called the frontliners. They said we are in the front, we are there to deal with the public's issues. But now we note that there is, on this resurgence, the public is complacent. The Department of Health, I don't say they are complacent, but many is in a Christmas mood. So the public, as we know, don't adhere to it. So it's to the public now. It's not to us anymore. We can only be strict towards the public and say protect the nurses out there, because if you're not going to protect us, public and community out there, then there is going to be no nurses to look after you, to look after your family, to look after your mother and father at the end of the day. So the public, you are the frontliners. We are not the frontliners anymore. Respect us. Thank you.
All right, thank you very much. That was Eleanor, the provincial chair of DENOSA in the province. Strong words there, Yuveka, pleading to the public to adhere to the protocol, saying that they're not only putting their lives at risk, but they also need support from the public as well as the department.
Yeah, because I suppose we forget, Nobasutu, that they deal with hundreds of people a day, everyone who thinks that they need that special care when they have to deal with so many people and so many emotions as well. It's not just individual medical care, it's emotions they have to deal with. Thanks so much for that. The Western Cape certainly battling a lot more than many other provinces as well. Well, the other province where we have to worry, I suppose, is KZN. That's where we find Mawande Keso. Mawande, a very good morning to you, and I suppose, yes, lots of worry there for you as well with the influx of holiday makers. Beaches or no beaches, they'll still want to come, get out of other provinces and come to where it's more fun, I suppose.
If I may paint a picture for you, over the festive period, KZN was said to be expecting at least 600,000 visitors. Now, while this is happening in the background, we've learned of the 501V2 variant of COVID-19. This was discovered by a group of KZN researchers. Now, this variant is said to be highly transmissible and is believed to be behind the surge of the COVID-19 second wave. Now, KZN is about number 4 on the list in terms of the contribution to the overall infections that have been identified in the country, currently sitting with having had over 157,000 confirmed cases. Now, of those, we are then faced with a situation where some paramedics as well as ambulance services have reported to getting to hospitals and finding that there are no COVID-19 beds, while some hospitals have had to increase their capacity by taking certain wards that may not have necessarily been earmarked for COVID-19 patients. Now, that very same private sector we speak of is sitting with over 1,500 COVID-19 infected patients. Now, this is quite an alarming number, considering that we might face that situation where there have actually been cases where patients had to be diverted and turned away. But now the Department for Health in the province has come into the fray and said that there's no need for panic. It's got the situation under control as far as the contingency plan is concerned in having beds. Let's hear what the MEC Nomakukusmela Zulu has to say.
We are quite ready for the second wave. We are ready in relation to the bed availability as well. We currently have more than 3,000 beds available. Remember, when we were first hit by COVID-19, we had to repurpose some of the facilities that we have, and that was an investment that is permanent within our own facilities all over the province. We had to put up, or we did put up 4 what we call field hospitals. One is in King Kechwayo, which is in Gwelizane Hospital. The other one is in General Kizenga Mpanza Hospital, which is in Ilembe. And the other 2 are in Clearwood Hospital, eThekwini. Now, of the 2 that are in eThekwini, we get more than 220 beds out of that, and 113 in each of the other ones that I've counted.
All right, we'll leave that there for now. And that's the outlook, yes, in various provinces. 4 of them we've covered for you this morning in terms of COVID-19 numbers, how facilities are coping, how authorities are coping, and just what the plans are for the end of the festive season when everybody goes back home after visiting various provinces and leaving their safe spaces. We'll be back with more news for you in just a moment.